In this episode, you will learn about
some challenges our transgender patients face in the evolving landscape of American politics,
the importance of gender-affirming care and the risks of banning this care,
some simple ways to improve ED care for our transgender patients,
how we can better support our transgender colleagues in medicine and in medical training,
and how we can be advocates ourselves.
Welcome to EM Pulse, bringing research and expert opinion to the bedside.
We're your hosts, Sarah Medeiros
and Julia Magana.
In 2018, we aired our episode, Don't Be a Jerk, where we discussed definitions, best practices, and transgender care within the emergency department. These are all still completely relevant, so I encourage you to go and listen to that episode for a refresher on how best to take care of our transgender patients. But since that episode, the landscape of LGBTQ+ healthcare has become increasingly complex and controversial, with mounting challenges facing both patients and providers. So while things occurring in the political sphere can be a difficult conversation for us to have, it is so important to understand the landscape as it does affect the everyday lives of some of our most vulnerable patients. And while Anna and I do work for UC Davis, these thoughts and opinions are our own, and they do not represent the views of UC Davis or the University of California.
Today, we're honored to be joined by Charlie Adams, a remarkable fourth-year medical student at the Kansas City University College of Osteopathic Medicine. Charlie, a proud transgender man, has become a powerful voice for transgender rights and health equity. Charlie has a decade of advocacy experience, including protest organizing and testifying in front of elected officials on over 25 proposed pieces of legislation. In medical school alone, he has had more than 30 invited speaking opportunities at universities, residency programs, and equality organizations, and has been featured in the Washington Post and USA Today. Charlie's journey through medical school while advocating for transgender rights hasn't been easy. In an environment that's grown increasingly hostile to transgender individuals, he's maintained his commitment to both his medical education and his role as an advocate for change. We'll be having a conversation today about advocacy, the politicization of medical care, and our vision for a more inclusive future in medicine. Charlie, why is everyone talking about trans people?
I think that everybody in the country is pretty tired of hearing about trans rights. And if cis people are so tired of it, just imagine how tired we are as trans people to hear our rights and our lives debated constantly. There's a lot of people with concern that this may be a trend because they may not have heard of it much before. But my answer to that is go tell that to my 70-year-old trans man mentor who transitioned back in the 70s. Because if you were open about it and proud about it back then you didn't make it. So this is something that has been around for a long time. And I know that because I know a lot of elderly trans people. And there's just a lot more visibility and awareness than there was before. My coming out once I met other trans people is really a prime example of the fact that it's not people turning each other trans so much as being able to put the pieces together once you have exposure to people who have words to experience what you're going through. So something very similar to this is that being left-handed used to be very stigmatized in our society. We have stats that show back in 1932, 2% of people were left-handed, and there was a whole campaign to destigmatize it. And by 1972, 12% of people were left-handed. It's a very similar thing as far as people actually being able to live their lives and not being completely shunned. They're going to come out and say who they are then. And that's exactly what's happening with trans people.
That's such an incredible example.
Yeah, it's a really interesting comparison.
Yeah.
So, Charlie, tell us your story of how you became an advocate.
So my story as an advocate really goes all the way back to my childhood. I'm from Nebraska, and my parents always modeled community service for me growing up. My dad is a retired cop who was invited to the White House in his 20s for bravery, essentially, putting his life on the line to go into a burning building against orders and carry out a handicapped person on his back. And then my mom has been a pioneer in the field of social work. So really my whole life, I've been looking up to these heroes of mine who are changing the world based on their values of how they want to serve others. And so it only made sense for me from a young age when I knew I wanted to do medicine to want to do something in a way that was going to change things. And then also I had a very impactful experience as a child with my childhood best friend being of a different race than me and a different religion, unlike anyone else that I had met in my very homogenous community. And seeing the things that she experienced, the negative experiences that she had, really got me thinking from a young age about society and the way that we viewed groups as different from one another and the way that different people were treated, and got me thinking, what am I going to do to change things? And feeling like I have a responsibility to identify that and to act on it.
So it really feels like becoming an advocate or being an advocate just really is in the lifeblood of who you are and what you do. But like, what specific examples are most impactful in making you an advocate specifically for trans rights?
There's been a number of experiences, but I feel like I've been very lucky overall. I haven't had nearly as much discrimination in my life as many people in the trans community. But two things in particular really affected me. When I first came out and started socially transitioning, which means I wasn't taking medicine or anything. I cut my hair, I changed my name and my pronouns, changed how I dressed. And I was in this place where I knew that I wasn't cisgender and I wanted to be called Charlie. And some people in my life refused to recognize that. And that actually led to me to be estranged from family for a couple years, which was really difficult. I almost flunked out of college. I almost lost my scholarship. And I was lucky enough to make it through that. And I'm now about to graduate medical school, but not all trans people are that lucky. That kind of gave me a glimpse of what it's like for a lot of my trans siblings when they're coming out. And then more recently, after I graduated college, I was working at a pharmacy, and early on, the owner of the chain identified me and came up to me and said, I see so much potential in you. You're such a hard worker, and I'm going to take you under my wing and mentor you because I see you going places. So I was mentored by him, and essentially things were going great in that job. It was a fantastic work environment. And then when someone in the pharmacy found out that I was trans, literally overnight, it completely changed the way that I was treated. I couldn't get my work done anymore. People refused to speak to me. And I went from being a thriving worker to somebody that was slow, constantly being asked why my work quality was so much poorer than it had been before. And I tried to stick it through, but I just couldn't because the experience became so painful. So I ended up quitting that job and losing that huge opportunity and then having to start over. And this is something that happened repeatedly to me early on in my transition. It's an amazing example of the fact that 11% of trans people are fired, forced to resign, or laid off because of their gender identity, which then makes sense that a third of us live in poverty or have been homeless at some point in our lives.
That's so incredibly painful. And thank you for sharing that story. I just can't even imagine what it feels like to be in that situation.
I'm grateful for it just because I do think it has further instilled in me the need that now I'm in the position that I am in, that I want to spend the rest of my life fighting for this because, yeah, it should never happen to anyone.
Charlie, talk to me about some of the laws that have been passed against transgender individuals in the United States.
So these differ strongly by state, and the vast majority of them directly conflict with medical consensus around trans people and gender-affirming care. We know that 47% of trans people have considered leaving unfriendly states, and 5% have moved out of these states. And in Nebraska, where I'm from, and Kansas, where I've done many of my rotations, they're redefining sex in ways that impact bathroom usage. Some states also require surgery for changing legal documents, which goes completely against patient autonomy. It's extremely expensive and is required by many states, yet it's not covered by insurance. And then we know that 26 states have outlawed youth gender-affirming care. And then just from where I am right now, Missouri proposed over 40 anti-LGBTQ bills in 2024. And something really interesting about all these bills, there were over 600 proposed in 2024. Most of them don't pass, but that doesn't mean that they're not harmful because it's still stigmatizing and villainizing our community, which is already facing high rates of violence and discrimination. And we can see that calls to trans suicide lifelines, especially Trans Lifeline, which is the main one, they tend to spike when there are increases in these bills being talked about in the news. So we know that they're directly harmful to our community and especially to our youth.
Yeah, and it's taxing to fight these. It takes a lot of resources, and it's just, another burden on the community.
And I think we would be remiss in not mentioning that right now we're recording, it's January 21st, 2025, literally a day after all these executive actions have been proposed. And there's multiple, but at least one of the executive actions are talking about defining gender as only two genders, which just adds a whole nother layer of complexity on top of all of this.
Yeah, absolutely. I mean, it's definitely a scary time. We don't know what's going to happen. We know that it doesn't match the medical consensus that the physicians of America have agreed upon. And it's just really the Wild West out here right now.
So additionally in the news, we've heard a lot about transgender athlete bans. What do you make of that?
So you're right. They're constantly in the news. But something that I really think is important to discuss is the effect that this has on our youth. Professional athletics are irrelevant to the practice of emergency medicine. However, constant rhetoric around restricting transgender people from public life is extremely dangerous. And it's kind of in the same vein as constantly being discussed in any legislation. It's marginalizing our group further and encouraging more discrimination and violence. We know that less than 10 out of the 500,000 collegiate athletes in the NCAA are transgender, which is 0.002% of people. And yet, how much time and tax dollars has been spent discussing this group? Don't we have bigger issues? We know that 40% of trans people attempt suicide at least one time, and yet we're hammering it into the public that this group is a problem and that we need to discuss how we can keep them out of public spaces. We also know in 2021, there were 35 high schoolers who were trans participating in sports across the entire country, and they were already very unlikely to play, even less so now. So it's not protecting anyone, it's just harming us, including cisgender people and cisgender children.
And the medical community is behind you in saying this as well. The American Medical Association and the American Academy of Pediatrics both have policy statements supporting allowing transgender children to be in athletics. So it's not a medically complicated issue.
Yeah, and following on from what you were saying in terms of the high suicide rates, we talk about gender-affirming care as life-saving. What do you tell people who question that?
So it is true that the trans community has an extremely high suicide attempt rate, with 40% of trans people attempting suicide at least once. And there's been a lot of talk about, well, if that's occurring, then is this a mental illness? Is it not? But the truth of the matter is over 20 major medical organizations in America all declare that being transgender itself is not a mental illness. However, living in a body that feels alien to you can create mental illness. Being rejected by family, friends, school, work, your faith community can lead to mental illness. So it's twofold, really. And we know that the largest ever study of transgender people was done in 2022 on 92,000 transgender Americans. And it found that 94% of trans people were more satisfied with life if they were able to transition.
What is gender-affirming care? Can we just define that?
Fantastic question. Gender-affirming care is everything from talk therapy to hormones to surgery, anything medical that allows a person to modify their physiology in a way that matches how they identify internally. It's inaccessible for most people in that it is extremely expensive and insurance covers it variably. Some examples of this are surgeries like mastectomy, hysterectomy, orchiectomy, breast augmentation, facial feminization surgery, creation of a phallus or vagina, and then more commonly, hormone therapy, which is testosterone or estrogen plus testosterone blockers. It can also involve things like electrolysis, speech therapy, and talk therapy, as mentioned.
There's a lot of talk about gender-affirming care in teens and youth right now. How common is that, and what does that look like?
So this is a fantastic question. It's a very hot-button issue right now. Something to note off the bat is that youth gender-affirming surgeries are exceedingly rare, and yet it is talked about in the media as though it's happening constantly. Even in Missouri, there were signs recently that were just all over the place about how this amendment to reinstate abortion access on our Missouri Constitution, there were signs saying that Amendment 3 pays for child genital mutilation, which gender-affirming surgeries have never happened for youth in Missouri, and they're never going to, and that was not in the bill at all. But that's just a perfect example of the kind of propaganda and misinformation that's going around. We do know that from a 2024 Harvard study that looked at 3.8 million insured 15 to 17-year-olds, they found only 76 who had gotten top surgery, which makes up 95% of gender-affirming surgeries for youth. So that's 0.002% of those teens out of 3.8 million. And to be in that category, you have to be exceedingly wealthy, and essentially an entire team has to decide that you are mentally distressed enough that this is something that cannot wait until age 18. But if trans adults struggle so much to access gender-affirming care, which we do, then it's just kind of a ridiculous idea to say that youth are able to access it easily, because that's just not true. And studies repeatedly show this.
What about hormones for kids or hormone blockers?
Another study, a 2025 Harvard study of 5 million teens, looked at private insurance claims from 2018 to 2022, and they found that 18,000 of those 5 million were diagnosed with gender dysphoria of some kind. and only 1,000 were offered puberty blockers, and 2,000 were offered hormones at some point. So again, these are minuscule percentages, and yet it's proposed as though it's such a common issue.
Right. So we practice here in California. And interestingly, actually on Express Care, which was our telemedicine, I actually had a patient come in. They had just turned 18 and they were talking about how they were trying to switch physicians and get their gender dysphoria medications. And they were just like, I don't know how to get it. And quite honestly, me as a provider, I was like, I don't know where to send you or how to do this.
Yeah. And so even though this is, like you said, a very small percentage, why do you think so many states are banning youth access to gender-affirming care, including access to hormones and puberty blockers?
Really, a large reason is rampant misinformation. Lawmakers are claiming that there are concerns about bone density and regret that warrant the banning of these drugs, but the truth is that they have been approved for use in precocious puberty for over 50 years in cisgender children, but for some reason, since they're being used on trans children, now they need to be made illegal just for that purpose. The drugs they use for puberty blockers are gonadotropin-releasing hormone analogs, which stop testosterone and estrogen production. They hit pause to delay distressing puberty and buy time, and we know from decades of research that these are safe, effective, and reversible, and that teens who wanted them and got them have lower lifetime suicidal ideation than teens who didn't. We also know that according to a 2022 American Medical Association study, trans youth with access to gender-affirming care were 73% less likely to be suicidal. So in many ways, ideology and prejudice are getting in the way of saving the lives of these kids.
So we've been talking about youth gender-affirming care bans, but there's also been a move towards adult gender-affirming care bans as well, in many states, in a state that you're in as well, right?
Yeah, you're exactly right. So in 2023, there was a proposal to block gender-affirming care for all people in the state of Missouri. They didn't say it outrightly like that, but they did add on a bunch of standards that were almost impossible to meet for 99% of people that would have effectively limited and completely blocked access to gender-affirming care for people of all ages in Missouri. As a result, me and a bunch of my classmates decided to plan a protest to unite the healthcare community and the trans community in Kansas City. And we ended up having a huge rally and marching around City Hall. And then 3 days after that rally, the Attorney General's order was blocked by another court, essentially, making sure that we could get our hormones. But honestly, that was a scary time. People were planning to lose access. And for somebody like me, that's really the worst thing that could happen because I feel like my life is so much better. I feel so much more free and happy and just that things are the way they always were supposed to be. And if I had to go back, I just don't even want to think about it. I would do anything to not have to go back. So it's a scary thought to hold over people's heads. And that's why a lot of people in the trans community are just scared right now.
So we've been talking a lot about the political atmosphere that our transgender patients are living in right now. And for us as emergency physicians and providers, what are ways that we can make sure that we're taking care of our transgender patients in the emergency department and giving them the appropriate care?
So the first, fastest, and biggest thing that you can do that statistically shows us patients feel more comfortable is asking and sharing your pronouns, which immediately indicates that you're a safe person. But I will admit that in places like where I am in Missouri, that can be very politicized. So there's a couple big things to remember that asking somebody's pronouns is not offensive to trans folks. And a good catch-all for both cisgender and transgender patients is to just say, how would you like me to refer to you? And then if you do make a mistake, to not treat it like the end of the world, because end of the day, what matters is not 100% accuracy. It is genuine effort. Since we're smart enough to become physicians, since we're smart enough to practice medicine, it will become easy quickly. I think a lot of people just don't try for fear of making mistakes, and that's absolutely not the route to go. It's much better to try and make mistakes than to just ignore it. Some statistics that show just how effective using people's names and pronouns are, especially when it comes to youth. In 2018, a study of 129 teens showed decreased depression, suicidal ideation, and suicidal behavior when chosen name was used among trans teens. Within healthcare settings in particular, trans youth with their gender identity accepted showed a 32% decrease in suicidal behavior. There's a lot more studies out there that you can find online, but that alone says a lot. So what I would recommend if you do misgender a patient is just quickly apologize, quick sorry, and then move on without dragging it out, and you are good. Just keep on rolling.
Yeah, and we can even put this into the EMR now. So it's easy enough to, once the very first person, registration or whoever, has asked the patient their preferred gender or their preferred pronouns, that can be entered into the EMR for everyone else to follow.
And in fact, UC Davis was actually the first hospital system in the country to be including gender pronouns in our EMRs. And that's like a stat of UC Davis that I'm really proud of.
Very cool.
Another great option is to just wear a pronoun sticker on your badge, or you can wear a pride flag or a trans flag. I know that, especially in my earlier years of my transition, when I was facing a lot more discrimination, that seeing that would immediately give me a huge sigh of relief with people. And I know the same from talking to a lot of other trans people. It kind of lets you know that somebody's on your side and you're going to be listened to and treated well. So that's very powerful.
Now, that's something I actually incorporate into my everyday practice. I have a small little LGBTQ plus flag on my lanyard. And I've had patients actually talk to me about it and kind of know that quietly I'm an ally to them. And it's been really helpful for our rapport building.
Exactly. Another thing to keep in mind is that invasive questions are extremely common for trans people. Healthcare is the one place that such questions can be necessary. But nevertheless, it's still important to explain the relevance, because often people will come in even for things like a broken ankle and then be asked by healthcare providers about future surgeries, and it can be kind of triggering. So it's extremely helpful to say, hey, if you have abdominal pain, it may be necessary for us to know your anatomy and surgical history, and just keeping in mind that it can be a touchy subject for trans people so that you can explain and make sure that they don't feel singled out.
So, Charlie, you and I have been doing advocacy and working together in organized medicine. And a very common question that I get asked by trainees, by med students, is how do we tackle advocacy on such a difficult topic that could possibly put you at odds with supervisors or folks that could affect your future?
It can be a fine balance. And I know earlier on, I felt a responsibility to put out every fire, but I've realized as I've gone along that not only is it not possible for me to do that, but it's not my job. My job is to be a student. The best thing I can do to serve the trans community is to graduate. So there are certainly times where I have spoken up and sometimes butt heads with people, but end of the day, I know that I need to protect myself so that I can move on to bigger hills to advocate for my community.
Right. I tell folks that advocacy is a marathon, not a sprint. Right? We have to do everything you can to become a good doctor first and foremost, so that you can actually then use that doctor title for good and be able to take care of folks. So really have that doctor armor on. And if you can't become a doctor, then that's going to be a lot harder to do.
Yeah. So, Charlie, you are on the last legs of your medical school journey right now. You've been applying and interviewing, and in a few short months, you will be starting residency somewhere. Are you taking into account the political environment in terms of where you want to stay in practice, or how is that affecting your decision?
Yeah, so when I was applying to residency, there were definitely programs that I applied to that I'm not interested in going to anymore, because I don't want to be training in a hospital where there's active bathroom bans in that state, and I am legally required to use the women's restroom. You can't see me through this, but for context, I have a full beard and chest hair, and just if I go into the women's room, people are not going to be too happy about it, nor do I want to go in the women's room. But some states are actively requiring that right now, and there is concern that the number of states passing such blatantly harmful laws is going to increase as we move along. So I'm avoiding certain places. At the same time, I am from areas that are passing a lot of harmful legislation, so I also want to somewhat challenge myself to continue living in such areas so that I can keep advocating, or at least if I go away for residency, to come back to said areas in the future so that I can work to make change.
So, Charlie, we've been talking about doing advocacy, but how does that look like in your life? How have you been able to do advocacy?
So I've testified on a lot of bills. I've been involved in organized medicine. And in the last year, I also created an Instagram page that now has over 65,000 followers, which I did not expect to happen. But essentially just sharing my advocacy adventures and my perspectives on various issues, both in medicine and affecting the trans community. It's something that's led to just a ton of community and new friendships all around the country and the world, and increased a feeling of solidarity that I already felt with my community. And I feel really, really grateful for how that's ended up.
One of the biggest building blocks of advocacy is really storytelling and just getting people to understand or just to hear those personal stories, emotional touch points. The amount of times I've gone into legislators' offices, you can like throw facts at them, but their eyes will glaze over. But once you tell a story and something emotional, they're able to understand it so much more. And it's incredible that you've been able to tell your story on social media, on these platforms, and be able to get more folks listening in and learning more about your journey and your story.
Thank you so much. It just means a lot to me that it resonates with people, because honestly, it's exactly what I needed when I was a little kid. And it kind of soothes my soul to be the person out there saying that this is possible now, so that hopefully the next generation of trans youth can see that they can be whatever they want to be.
Charlie, it's been incredible having you on the podcast today. Your story is inspirational and really helps me keep on having hope of trying to do advocacy, especially in an era where we've been having the more and more politicization of medicine. Do you have any tips or any advice for us who want to keep on doing this work?
My number one tip, and it sounds easy, but that's because it is just show up and keep showing up. I don't think I'm a natural speaker in any means. I used to be very shy when I was younger, but I have passion and I want to help contribute to progress on this issue. We just need more people to show up and keep doing the work, or even show up in small ways where you're working in your own social circles when people don't understand. Help explain why trans rights are valid and important and why we need to respect trans people. All of us can make a contribution and all of us have a small role to play. And then on a larger scale, showing up to testify at your local city and state school boards or legislative sessions is extremely important, and most of the time is open to all citizens. I know in Missouri, you can literally just show up, you can speak, and they have to listen. So that's your right as an American, is to go and testify, talk to your legislators, and truly is very, very effective, especially when you have a physician education behind your name. So that would be my biggest request, is that people show up and help us do that work.
It's really amazing how much Charlie has achieved already. He's such a great advocate and a wealth of knowledge.
Yeah, and I am sure that we are going to see more changes in the coming months and years. So come back here for updates.
And we want to thank the UC Davis Department of Emergency Medicine for advocating for all of our patients.
And thanks to OM Productions for amplifying our voices.
Until next time, stay curious, stay inspired, and stay tuned.